who's a proud Wiradjuri woman who's going to do our acknowledgement to country.
Thank you, Ingrid. My name's Serena Williams and I'm a proud Ngunnawal Wiradjuri elder, woman of this country. I was born here in Canberra and reared here in Canberra and have many connections and ties to community, to country, and, you know, being a proud Aboriginal Ngunnawal Wiradjuri woman, I'd like to acknowledge my daughters, Pearl and Minnie, and a little grandson, Kevin Crow. He's named after his beautiful great-grandfathers, Kevin Carmody, if anyone's ever heard of him, and Crow Williams, who was one of the first four with Aboriginal Tent Embassy here, my father, their grandfather, great-grandfather. Also with a lot of things getting up here in the ACT, like the Aboriginal Legal Service and so on. A bit about myself, I thought I'd like to acknowledge the National Centre of Clinical Research and for Drugs for inviting me here today to do Welcome to Country. And a Welcome to Country is acknowledging the business that you're actually doing on country. And for me, I'd like to acknowledge this conversation because these conversations need to happen. I think we've all personally have our own personal story with, and I'm not going to talk the big jargon words. I'm going to be in very layman terms. ICE, well, what it's actually doing in the communities to our people, particularly in the Aboriginal and Torres Strait Islander community. I worked with Lifeline and I wrote accredited training on DV Alert version 1 and 2 on to recognise, respond and refer to cases of domestic and family violence. And within that research that we did an evaluation, a lot of the domestic violence is the oncoming of Western society ways, particularly because I went into remote Indigenous communities, I went into 28, and of drugs, alcohol and other drugs, you know, that they were the main factors of why DV was occurring so much. Although it occurs in all cultures and religions and races, wherever you go, and it's no one's culture, DV. Another thing that I did, and I'm very proud of, is I founded Mulyan Mura, which is an Aboriginal access to justice for Aboriginal and Torres Strait Islander women here in the ACT. Mulyan, the wedge-tail eagle, is our totem, and Mura is pathways. And we had a lot of women coming through the system of, you know, Canberra being the highest pro rata of children being removed here in Australia. A lot of women that were actually on drugs that were having their children removed, still going through DV, relationship breakdowns and so on. We've also seen a lot of grandparents, particularly grandmothers, that were dealing with their children or their grandchildren that are on drugs and, you know, taking up the fight for them, and you know, we need to reduce this. So I hope in this conversation that you highly speak of Aboriginal and Torres Strait Islander people, the first peoples of this country, and, you know, embrace that conversation, because that's who we need to look after very first and foremost, the people of this country, and change that education, change the methods of how you clinically work with people, I suppose, that have been, and no one knows it better than someone who has had an addiction to drugs, because there's grief and loss, there's the removal of being a part of family, and that's very big for us as Aboriginal and Torres Strait Islander people. As an Ngunnawal person, I would like to acknowledge my elders, past, present and future. I'd also like to acknowledge any other Aboriginal and Torres Strait Islander people in here today and on web, out in the wider community. And it gives me the great pleasure on behalf of all the Ngunnawal families to welcome you here to country as an elder. Yeramura, I will sweep the lands for you to leave your footprints here on our beautiful country. Najan, the water of the Murrumbidgee, the Molonglo, the Gudnabi and the Royal, that will cleanse you of all harm. Mulyan is the totem of the Ngunnawal people. She is the wedge-tail eagle, and she will guide, protect and oversee you on your journey here. Welcome, welcome, welcome to Ngunnawal country on behalf of myself and all other Ngunnawal families, my daughters, my grandson, and I hope you have some great conversation and working forward in a positive way to help the great addiction that's out there in the communities for everyone. and how it's affecting all families, community, society, and I welcome those conversations. Thank you.
If I would like to start today as well by acknowledging the traditional custodians on the land on which we gather. For those that are attending in person this symposium, that's the Ngunnawal people, and I pay my respects to elders past, present and emerging. I also extend that respect to First Nations people joining us today, both in person and online. My name is Belinda Roberts, for those of you that I haven't had a chance to meet, and I'm the Assistant Secretary of the Alcohol, Tobacco and Other Drugs branch in the Department of Health and Aged Care. I'm delighted to be here today to welcome you to the 2022 National Centre for Clinical Research on Emerging Drugs. I had it written down so I would remember, NCCRED Symposium. It's wonderful to see so many of you here today in Canberra and attending virtually. I'd also like to take this opportunity to thank NCCRED for inviting me to welcome you all here today. As many of you may be aware, the Australian Government has provided funding to NCCRED since 2017 through the National Ice Action Strategy. This funding has been extended for a further 4 years until 30 June 2026 and will ensure that NCCRED can continue its important work. NCCRED continues to bring together clinicians and researchers to detect and respond to methamphetamine and emerging drugs of concern, identifying trends and translating research into clinical practice. Since its establishment 5 years ago, NCCRED has developed consortium arrangements with the National Centre for Education and Training on Addiction, the National Drug Research Institute, the National Drug Alcohol Research Centre and St Vincent's Health. This ongoing collaboration is supporting evidence-based research and maximising its relevance to the sector. NCCRED has also developed and implemented the Prompt Response Network to support the surveillance, early detection and response to drugs of concern. The department is pleased to see that this valuable resource is receiving national and international recognition as an effective early warning system model. Since its establishment, NCCRED has built capacity in the sector through enhancing the clinical skills and knowledge of the workforce responding to drug use. This includes clinicians, health professionals, those dealing with family and friends, and researchers. This has been achieved through a range of resources and materials produced by NCCRED, such as the Clinical Practice Guidelines, the Methamphetamine Clinical Guide for Primary Care, the Emerging Drugs Guidance for Consumers, Friends and Families, and the Emerging Drugs Resource for Health Professionals. The recent release of the VANs, short for Video Abstracts by NCCRED, is another useful resource for consumers and health professionals as it translates valuable research and information into easily understood short videos. NCCRED has also undertaken a range of clinical research projects, including the current studies which are exploring the use of lisdexamfetamine for methamphetamine withdrawal and in reducing methamphetamine use. You'll hear about a number of these projects further in today's symposium, and I look forward to hearing about the latest clinical research findings and development. I'm now very pleased to hand over to Professor Nadine Ezard, Director of NCCRED, who will provide her introduction.
Thank you, Belinda and Elise. Really, thank you for coming here, because we know it's a parliamentary sitting day where we fixed the date. It wasn't, but then the days got changed, so apologies, and really grateful that you did manage to come and open this day. And thanks to Serena. I know she had to go and get the kids to school, but I think that reminds us how our project really must be First Nations first, and we're not there yet as NCCRED, and it's a work in progress, and it's something that we must continue to strive for going forward. But thank you everyone for being here. Thank you for coming along. This is the first time we've managed to meet in person since 2019, so we're really happy to have everyone here, but also happy that we've now moved to a hybrid kind of format, so I can welcome the 200 or so odd people that are online as well. I think I'm hoping that this kind of hybrid modality is here to stay so we can share and communicate going forward, and really make sure that the questions we're asking are the right questions, because that is at the core of what we're doing. Make sure that we ask the right questions so that the answers will have meaning to people who are perhaps struggling with methamphetamine use, feel out of control with their use, or would like to know more about how to decrease harms related to their use, and the clinicians working for them, and for working with their families and friends and loved ones as well. I'm not going to speak too long. We do have a presentation from our international supporter at UNODC, Anja Busse. it's not a convenient time for her in Vienna, so it will be pre-recorded. Sorry, Robert, I know you were hoping to meet her in person again, and those that might know her in the room as well. But we are on a tight schedule. My concentration span is short, like most adults, so we've gone for the 10-minute kind of section just to keep the action happening, and people are available in the lunchroom and the tea break and online if there are further questions that people want to follow up, because we haven't gone into sufficient depth. But I would like to welcome everyone here today that's managed to come here to Canberra, and to all those online. And without further ado, let's open up to the online presentation. Thank you.
Having us here at the 2022 NCCRED conference. My name is Anja Busse, and I work with the United Nations Office on Drugs and Crime. And we're really very humbled, I have to say, and wish we could be there and learn from all the excellent speakers that will be speaking during this symposium. So I'll share a few slides with you about global trends of stimulant use and stimulant use disorders, and the need for effective and scalable treatments of such. So for those that you do not know, UNODC is part of the United Nations Secretariat, so we report in the end directly to the Secretary General of the United Nations, Antonio Guterres. And while our headquarters is in Vienna, we're mainly operating through our 150 plus field offices around the world. So I'll speak to you about some data, mainly from World Drug Report on stimulants, stimulant use, and so on. And then I'll share with you some of the work that UNODC does in seeking effective and scalable options to address stimulant use disorders. And I will close with my dreams for the future. So in terms of the data. So in World Drug Report, we estimate every year the number of people using internationally controlled substances worldwide. And it has been estimated that around 284 million people have used an internationally controlled substance in 2020, or 5.6% of the global population between 15 to 64 years, which means a 26% increase in the absolute number since 2010 of people, but in terms of prevalence rates is more stable. Around 37 million people are estimated to live with drug dependence and would in principle benefit from accessible drug treatment services. And you see that the majority of people have been using cannabis, followed by opioids, and then the three stimulant groups, amphetamine, cocaine, and ecstasy. In terms of the different stimulants, and I'll not speak about cocaine because I've seen that your emphasis in the conference is on methamphetamine more. So in terms of amphetamines, there is an estimated 34 million people that have used in the year 2020, and the highest prevalence rate is in North America, followed then by Australia and New Zealand. Here you can see the predominant use of amphetamine versus methamphetamine in the different countries, with the purple being methamphetamine, so that's where Australia, for example, comes in, or amphetamines, which is more the yellow then. So there has been more and more reports about an increase of harms associated with methamphetamine use. So for example, data from the US show that it plays a role in fatal overdoses, both as a standalone or mixed with opioids. And also from Oceania, so especially Australia, reports have reached or have been included also in World Drug Report that even though methamphetamine is not the mainly used stimulant in the country, that would be cocaine, methamphetamine is very much associated with the onset of drug use disorders. It's the most frequently injected substance and the one leading to the highest number of people in drug treatment, and also has been among the top 3 substances associated with drug-related deaths in Australia. So just kind of as a side note, that Afghanistan, that has been very much kind of known as a producer of opium globally, now is also emerging as a production country for methamphetamine. And among the seizures of methamphetamine originating from Afghanistan that have been made, those also have been made already in Australia. So a few words on the global use of ecstasy, which is really the label for a very mixed bag of substances. So the global prevalence here would be at 0.4% or 20 million people in the year 2020, and the highest prevalence globally is here in the region of Australia, New Zealand, and Oceania. But the highest number of people using ecstasy would be in Asia, with 10 million people. Ecstasy or MDMA use has been much affected by the COVID-19 pandemic, especially due to the closure or temporary closure of recreational venues where that has been much used. And also UNODC has an early warning system on new psychoactive substances. And as you can see here, in the years 2021, 2022, 30% of those NPS reported to UNODC were stimulant substances. So in World Drug Report, you also see what countries are reporting as the most harmful drugs. And in the middle, you see that 11% of countries have reported stimulant drugs, which include amphetamine type stimulants or cocaine type stimulants, as the drugs causing the greatest number of drug-related deaths. And you can also see with the purple being amphetamine type and orange cocaine, the percentage that it's associated in member state reports with drug use disorders or kind of causing the need for drug-related treatment. Different regions have different needs or different profiles for drug treatment. The stimulant use disorders you see here, the darker blue, being amphetamine type stimulants, being the substance for which treatment is mainly sought for, including in Australia, for example, and the yellow would be the cocaine type drugs causing most treatment demand, for example, in North America and parts of South America. Patterns of treatment demand have changed over time, and for Australia, you can see here that over the last decade, the proportion of amphetamine type stimulant use disorder treatment has increased very much. The treatment gap is something that concerns us very much at global level, because from all these 37 million people that we mentioned before that would in principle benefit from treatment of drug use disorders, de facto only 1 in 8 has access to any form of drug treatment, and that still doesn't say anything about the quality of such. Women remain especially underrepresented in overall treatment of drug use disorders, and that's very pronounced also for amphetamine use disorders, where 45% of the people using amphetamines are women, but only 18% of the women in treatment. So there must be barriers along the way. So now I'll say you a few words about what we are doing at UNODC to develop or seek effective and scalable options to address stimulant use disorders. On one side, just to mention that there is the CND, the Commission on Narcotic Drugs Resolution 59.8, that is encouraging clearly the UN member states to develop and implement prevention, treatment, and rehabilitation for problems related with both new psychoactive substances and amphetamine type stimulants, and also to address the negative consequences of these substances. So UNODC, very typical for a UN organization, one of the things we have been doing is develop technical guidance. So for us, any technical guidance at the moment starts with both the international standards on drug use prevention and the international standards for treatment of drug use disorders that have been developed together with the World Health Organization. In 2019, we already launched the publication on treatment of stimulant use disorders, current practices and promising practices. And in terms of psychosocial treatment, what's recommended here without much surprise is contingency management, cognitive behavioral therapy especially. But we have also discussed pharmacological treatment options, both for intoxication, withdrawal management, and the management of dependence of stimulants. So both in terms of intoxication and overdose kind of interventions, what you will find in the document are especially symptomatic treatments. And unfortunately, we still do not count on a medication that can quickly and safely reverse life-threatening stimulant overdoses. Also, stimulant withdrawal management has been summarized, or the recommendations made are mainly towards symptomatic treatment. And where it really gets interesting now is around pharmacological treatment of stimulant dependence, with a lot of research going on around the world. So far, maybe none or no medication has really been consistently shown to be shown efficacy, and none has been approved so far. But what we would be looking for is a medication that's orally effective, has a slow onset of action, a long duration of action, and then a slow offset of action. So, and what are the most promising medications so far, as summarized already in 2019, and then also reconfirmed in the review here from 2020 by Tardelli and colleagues, would be extended release formulations of amphetamine products in the treatment of cocaine use disorders, and also kind of extended release formulations of prescription amphetamines in the treatment for amphetamine use disorders. Just to say that in terms of technical guidance, UNODC, our HIV colleagues have also developed guidance on HIV prevention, especially for people using stimulant drugs, and especially they are looking at certain high-risk groups like people in prison, sex workers, people injecting drugs, and so on. And what you find in this document is especially the whole spectrum of harm reduction interventions, including needle syringe programs, overdose management, acute intoxication management, but also kind of the recommendation again on evidence-based psychosocial interventions and drug treatment. So, I mean, in conclusion for this document, what we're really advocating for would be low threshold services integrated with attractive and evidence-based psychosocial and pharmacological treatments that then can attract people using stimulants to services, and once in contact, hopefully also increase retention rates. Another thing that we are doing in addition to providing technical guidance, and at the moment in reality more informal for lack of resources, is a provision of platforms for exchange among policymakers, among also researchers that are already having funded trials on especially pharmacological treatment of stimulant use disorders to enhance the discussions across continents and countries around medications to be used, study outcomes, so that future meta-analysis can kind of pool from more comparable data. And our vision remains a multi-country study on psychosocially assisted pharmacological treatment of stimulant use disorders with a view to effectiveness, safety, implementation factors, cost effectiveness. Another kind of vision for the future would be a feasibility study on contingency management in low middle income countries. In kind of also what we are doing as the UN agency is to provide capacity building, and as we can develop implementation studies. So we have been doing, and we have training packages on both stimulant use disorders and interventions for new psychoactive substances, in addition to those already mentioned, and widely integrated with our TreatNet training package. In the international standards and beyond, WHO has recommended, in addition to contingency management and cognitive behavioral therapy, also family therapy for treatment of stimulant dependence. And one of the interventions we have developed and implemented and evaluated is a feasibility study on family therapy for adolescents with substance use disorders. This has been done 2019, 2020 in Indonesia, and since then the package is rolled out all around the world. In this initial study, we had kind of a lifetime use of 10% of amphetamine among the adolescents that participated in the study. And overall, the study showed feasibility, so it was possible, and with satisfying fidelity rates, this training kind of could be implemented in real-world community settings. the number of adolescents who used amphetamines as well as other substances was reduced, and there was a significant decrease in parent-reported mental health problems among the adolescents. If you want to know more about this, a feasibility study is available in a number of scientific articles and in a report on our website. So closing, dreams for the future would be really this mentioned multi-site international research study on psychosocially assisted pharmacological treatment of stimulant use disorders, as well as a feasibility study on contingency management in low middle income country settings. For that, we're also very much looking forward to the results of the contingency management study being now implemented in community settings in Australia. Would like to understand more about the barriers women are facing to access services, women with stimulant use, and obviously to continue the work we are doing in terms of providing exchange platforms and providing technical assistance and trainings for our member states. With that, I thank you very much for your attention.